Have you ever really thought about what's happening inside your body while you sleep? We tend to think of it as this quiet time, a moment for the body to just shut down and recharge. But what if, for millions and millions of people, sleep is actually a nightly battle? Today, we're diving into the really dangerous and often hidden connection between high blood pressure, what doctors call hypertension, and a super common sleep disorder, obstructive sleep apnea. We are going to pull back the curtain and see how a night of bad sleep can have really serious long-term consequences for your heart.
So here's what we're going to cover. First, we'll break down what hypertension and sleep apnea actually are, just on their own. Then, and this is the really fascinating part, we'll see how they're locked together by this nightly chain reaction happening inside the body. From there, we'll look at the serious long-term damage this does to the heart, and, most importantly, we'll go over how these conditions are diagnosed and treated so you can protect your health for the long haul.
All right, first up, let's talk about the condition that's often called the silent killer, hypertension. It sounds complicated, but it just means the force of your blood pushing against your artery walls is consistently way too high. And that name, silent killer, is just so fitting because for most people there are zero symptoms. You can't feel it happening, but day after day, year after year, it's just silently wearing down and damaging your blood vessels.
To really get a handle on hypertension, you've got to understand the two numbers in a blood pressure reading. The first one is the systolic pressure. That's the top number. The easiest way to think about it is that's the peak pressure when your heart contracts to push blood out to the rest of your body. It's the maximum force, right during the squeeze.
And right below that, you have the diastolic pressure. That's the bottom number. So if systolic is the force from the squeeze, diastolic is the background pressure that's always there in your arteries, even when your heart rests between beats. Together, these two numbers give us a really complete picture of the stress your arteries are under, both when the heart is working and when it's taking a quick break. So what are the numbers we need to watch for? Well, a normal, healthy blood pressure is generally considered to be below 120/80. Hypertension, on the other hand, usually gets diagnosed when your numbers are persistently 130/80 or higher. And persistently is really the key word here. Look, a single high reading because you're stressed or you just ran up the stairs isn't a huge deal. But when it stays that high day in and day out, your entire vascular system is under constant damaging strain.
Okay, now let's bring in the second piece of this puzzle. Let's talk about obstructive sleep apnea, or OSA. And I want to be clear, this is so much more than just loud snoring. It is a serious sleep disorder where the soft tissues in the back of your throat literally relax and collapse while you sleep, completely blocking off your airway.
And when that airway collapses, it sets off this whole cascade of really alarming effects. First, the person stops breathing, sometimes for 10 seconds, sometimes for a whole minute or even more. This, as you can imagine, causes a huge drop in blood oxygen levels. The brain, sensing this is a life-or-death situation, panics and forces a brief, gasping awakening to restart breathing. And this doesn't just happen once. It can happen dozens, or in severe cases, hundreds of times every single night, which just completely destroys your sleep quality.
And here's the crazy part. Most people with sleep apnea have no memory of waking up at all. They just feel absolutely wiped out the next day and have no idea why. A lot of times the clues are things other people notice, like really loud, disruptive snoring or those terrifying moments when they just stop breathing. For the person themselves, the signs might be waking up suddenly choking or gasping for air, having a headache every morning, feeling incredibly sleepy during the day, or just not being able to focus on anything.
So now we have our two culprits, the silent killer and the sleep thief. And this is where it all comes together. There is a very strong, very well-established link between OSA and hypertension. So let's break down exactly how a blocked throat at night leads to dangerously high blood pressure, not just during the night, but all day long too.
Okay, here it is, the nightly chain reaction. It all starts when the airway collapses and you stop breathing. Right away, the oxygen levels in your blood start to plummet. Your brain, which is incredibly sensitive to a lack of oxygen, sees this as a major emergency and sounds a powerful internal alarm. In response, your body gets a huge surge of stress hormones, like adrenaline. This makes your heart pound and your blood vessels clamp down, which causes a sharp, sudden spike in your heart rate and blood pressure. It's what forces you to wake up and take a breath. Now, just imagine that violent cycle repeating over and over and over all night long.
The system that's hitting that panic button is the sympathetic nervous system. You probably know it as your body's fight or flight response. It's this ancient survival mechanism that's designed to save you from, being chased by a tiger. But with sleep apnea, this emergency system is getting triggered again and again while you're supposed to be resting. So instead of being a time for rest and recovery, sleep becomes this nightly battleground,
putting your entire cardiovascular system under relentless, punishing stress. And this nightly battle, as you might guess, has really serious long-term consequences. The stress doesn't just disappear when you wake up. Over time, it causes dangerous and sometimes permanent changes to the way your heart and blood vessels work. And this highlights a really critical difference. See, for a healthy person, your blood pressure is supposed to naturally dip or get lower while you sleep. It's called nocturnal dipping, and it gives your heart and arteries a much-needed break. But in someone with untreated sleep apnea, forget about it. That restorative dip just doesn't happen. Their blood pressure stays high all night or even spikes higher with every single apnea event. This creates a really dangerous pattern called non-dipping hypertension. So why is losing that nightly dip in blood pressure so dangerous? Well, because this non-dipping pattern is directly tied to much, much worse outcomes. We're talking a significantly higher risk of stroke and heart attack, progressive damage to your kidneys, and ultimately an increased risk of death from cardiovascular disease. It's because your body is losing its single most critical period of recovery, night after night after night. This can also lead to this incredibly frustrating and dangerous condition called resistant hypertension. This is where a person's blood pressure just stays stubbornly high even when they're taking 3, 4, or even more different blood pressure medications. For doctors, this is a huge red flag because a massive percentage of people with this condition have undiagnosed sleep apnea. They're trying to treat the symptom, the high blood pressure, without realizing the root cause is happening every single night while the person is asleep.
Okay, I know all of that sounds pretty intense and maybe a little scary, but let's shift gears and talk about the solutions. Because the good news is, these interconnected conditions are very manageable. This is the part where you can absolutely take back control of your health.
So sleep apnea is diagnosed with a sleep study, and a lot of times you can even do it right in the comfort of your own home. The study gives you a score called the Apnea-Hypopnea Index, or AHI. That's just a fancy way of saying it counts how many times per hour you either stop breathing completely or have really shallow breathing. A score of 5 to 14 is considered mild, 15 to 29 is moderate, and anything over 30 events an hour, well, that's severe.
The number one gold standard treatment for moderate to severe sleep apnea is CPAP therapy. CPAP stands for Continuous Positive Airway Pressure. It's basically a small, quiet machine that delivers a gentle, continuous stream of air through a mask. That air acts like a pneumatic splint. It just keeps your airway open all night long, physically preventing those collapses from ever happening in the first place. So here's how CPAP directly protects your heart. By keeping that airway open, it stops those dangerous drops in oxygen. That means the brain never has to hit that fight or flight panic button, which calms down that overactive sympathetic nervous system. Your sleep patterns get back to normal, and most importantly, it helps bring back that healthy, protective nighttime dip in blood pressure, giving your heart the rest it so desperately needs.
Now, CPAP is an incredibly powerful tool, but it works even better when you combine it with some crucial lifestyle changes. Things like weight loss, getting regular exercise, cutting back on salt, limiting alcohol. All of these things can make a huge difference in both the severity of sleep apnea and your blood pressure levels, making the whole treatment that much more effective.
All right, let's bring this all home. We have covered a ton of ground. So what are the absolute key takeaways you really need to remember for your health?
Here it is, the vicious cycle, all in one place. Obstructive sleep apnea causes those repeated breathing pauses, which puts immense stress on the heart. That nightly stress raises your blood pressure again and again. Over years, this chronic strain dramatically increases your risk for heart attack, stroke, and heart failure. But, and this is the most important part, treating the sleep apnea can break that cycle. It often leads to a significant improvement in blood pressure and protects your heart from future damage.
So we're going to end with a question for you to think about. If you, or maybe someone you know, has high blood pressure that's just really tough to get under control, especially if it's paired with symptoms like loud snoring or feeling exhausted during the day, based on everything we've just talked about, should an evaluation for sleep apnea be on the table? The answer is a resounding, unequivocal yes.
I want to leave you with this final thought. We often take sleep for granted, right? We see it as just downtime or simple rest. But it is such a fundamental biological process, and it is absolutely critical for our long-term health. When it comes to your heart, getting healthy, uninterrupted sleep is not just about rest, it is about survival.